Well, welcome everybody. Welcome to this morning's meeting. It's and happy CPR week to everyone. If you're not aware of that, it's CPR week. For those of you who don't know me, I'm Chad Brown. I'm a board member for the Heart Association, and I also chair the Leaders with Heart campaign here in the Puget Sound. I'll give you a little bit of information about that in a couple of minutes. But thank you for taking time to join us this morning. So as I said, this June 1 through 7 is National CPR and AED Awareness Week. And, the Heart Association, one of their very important part of their mission is to make sure that everyone's prepared to save a life with those two simple steps. We have a little bit of trivia a little bit later on. I think you'll enjoy hearing about. You're going to hear from a survivor. We're actually going to have some training. We're going to talk about somebody who's impactful in terms of the high success rate with CPR effectiveness here in the Puget Sound area. And then if you've heard my story, I've actually my life has been saved by CPR. I had a sudden cardiac arrest a few years ago, and thanks to my wife who was beside me and knew how to do CPR, I survived. And again, you're going to hear from another survivor and a demonstration of hands-only CPR. Before we get started, I've been asked to just kind of cover a couple of housekeeping. Your view will be better if you can keep the side-by-side view on your Zoom app, and then also if you turn off closed caption, you probably have a little bit better experience. So before we get started, I'd like to thank our local CPR sponsor, Multicare Pulse Heart Institute. That's a mouthful, Bill. Multicare support really makes a huge life-saving impact in our community by supporting CPR education and other programs by the AHA. And I'm very honored to announce that Bill Robertson, the president and CEO for Multicare, is the chair for our Heart and Stroke Walk this year. And he's joining us this morning. So good morning, Bill. Welcome.
Good morning, Chad. Thanks for the welcome. It's an exciting time to be involved in the American Heart Association, and I'm excited about the walk this year and privileged to be involved. Multicare obviously has a significant emphasis on cardiac and vascular health, and also on helping people who have cardiac and vascular challenges. So it's a privilege to participate. I've been working with American Heart Association since the late 80s. So I'm excited to be engaged here and excited about the walk this year. So thank you.
Yeah, well, thanks for chairing that. That's going to be a very successful event, and I really appreciate your leadership there. So we're going to start out by giving everybody kind of a short warm up and icebreaker to kind of let you get to know each other. They're going to break us into rooms where you can introduce yourself, tell folks your name, a little bit about your career. And since it's a CPR Awareness Week, maybe you can talk about your comfort with giving CPR, or if this is the first time you've learned to do CPR, or any other story or relationship you might have would be helpful. And then we'll do this for a couple of minutes, and then they'll bring us back. And we'll continue with our agenda. So I'll turn it over to AHA to get us broken out into rooms. Welcome back. I hope you enjoyed that. I always felt like I could use a few more minutes, but we're grateful to have the 4 or 5 that we did. So before we continue, I alluded to the fact earlier that I head up the Leaders with Heart campaign. And just for those of you who are unfamiliar with that, it's a group of community members from all types of walks of life. Come from all aspects of the Puget Sound area. And I think each person is dedicated to making that lasting impact in the fight against heart disease and stroke, and then in growing longer and healthier lives, through health equity. To become a Leaders with Heart, all you have to do is raise your hand, and then you're in, and then you commit to raise $5,000 for the Heart Association to any combination of a personal gift and or community funding. I'm especially proud that our group, because this month actually in the month of May, we actually raised over $53,000, which was twice a goal that we had set out to raise. And as a result of that, we've unlocked the opportunity through the Heart Association to donate 50 CPR training kits throughout the community. And again, as a survivor of somebody who's had sudden cardiac arrest, it just takes one kit, right, to make a difference, and one person to make a difference. So this is really a great accomplishment, and we're happy to share those results with you. So before we start giving you some personal experiences and a conversation with Dr. Ray, we got a little bit of CPR trivia we thought we'd come up with. If you just go to those slides. So yeah, great, here we go. So who knows the difference? And you can either talk or raise your hand, or you just wait till the answer comes up yourself. So what's the difference between a heart attack and a cardiac arrest? Dr. Ray, you can't answer. All right. A heart attack is really a blockage of the circulation in the heart, where you could actually infarct the myocardial tissue. And a cardiac arrest is an electrical event when the heart actually starts beating so rapidly it's ineffective. So those are the two differences. 2 is yes or no, is CPR appropriate for somebody experiencing a heart attack? Remember the differences before will lead you to this answer. And the answer is no. Someone experiencing a heart attack still has a pulse, and so CPR is not appropriate as it provides that artificial heartbeat. All right. I mentioned this earlier. If you were listening, we'll see. How many steps are involved in hands-only CPR? It's a little bit of a trick question. It's 2. First, you got to call 911. Very, very important step. You call or have somebody call if you're there with them. And then start CPR yourself hard and fast. We'll get that demo a little bit later on. All right, I think we've got, yep. This is a great one. How many out-of-hospital cardiac arrests occur every year in the United States? So these are people that are at home, at the grocery store, not in a hospital. How many experience a cardiac arrest? Over 350,000 people. So it's quite significant. Okay. And then nationally, what percent of those 350 receive bystander CPR? 18, 35, 46, 54. What would you guess? All right. 46%. And I'm really excited to share the stats about King County. It's really impressive, but on average, it's 46% of those folks receive CPR, which means the other half don't. That's a really critical point here to understand. And then how many cardiac arrests occur in the workplace each year? 10,000, 5,000, 15,000, 500. These are folks at work. And the answer is 10,000. So happens quite frequently. And unfortunately, a lot of places where we work, there are a lot of access to AEDs now that might not be accessible in other places where you might run into somebody who's had an arrest. I think, another one, true, false. Where you live may impact whether you receive bystander CPR and survive a cardiac arrest. So based on where you live. And the answer is true. Unfortunately, social determinants of health have been shown to contribute to your chances of survival after cardiac arrest. Survival rates, likeliness to receive CPR are lower in Black neighborhoods and in other under-resourced low-income neighborhoods. So that's an unfortunate fact. Nationally, what percentage of people actually survive a cardiac arrest? 5%, 10%, 25%, 30%? And the answer is 10. It's a low number. It's quite striking. I'm excited to tell you how King County performs with that a little bit later on, but it's a very low percentage. However, if you're one of those 10%, it's really important. All right, great. So thank you very much. That was fun. Appreciate the guys putting that together. Okay, so as I mentioned earlier, I'm very passionate about advocating for CPR training. I was at home one evening and suffered a cardiac arrest. Fortunately, I was lying in bed beside my wife. She was able to call 911 the fire department arrived and she performed CPR on me for about 10 minutes, which continued for another 30 minutes after they arrived. So I'm really, really fortunate to be here. And so just knowing that one person that knows how to perform CPR is really important. Fortunately, I was at home, and a lot of times CPR occurs, or the need for CPR occurs when you're with your family, but sometimes it doesn't. And so I'm very grateful to be here. And I'm going to introduce now Leslie Martin from Multicare, our local sponsor for CPR sponsor of the Heart Association. Leslie, thanks for joining us. I'm going to turn it over to you, and she's going to actually give us a demo on hands-only CPR.
Yes. Good morning, everyone.
Morning.
My name is Leslie Martin, and I am a nurse at Pulse Heart Institute. Just a little bit of background about me. I have been a nurse for 6.5 years. I actually started off doing traveling nursing, which was a great experience and what allowed me to go to multiple different hospitals and kind of get training at multiple different hospitals all over the country. So I have traveled to Kentucky. I've been down in Santa Barbara. I came up to Washington where I met my husband and then landed a permanent job at Pulse Heart. So I've been at Pulse Heart for about 2 years. It's a huge cardiac clinic. We're just growing and growing every day. So very, very large cardiac clinic with many providers and many patients. I provide triage, and answer questions for cardiac patients who call in about different things, medication, different symptoms that they're experiencing. They can always call in and a nurse can help, give them advisement on what they're going through. I also work downstairs in the basement. Pulse has a nuclear stress test department. So I work down there performing stress tests, which is specialized imaging that we're able to do in our office. It gives us pictures of the patient's heart at rest, a very specialized image of the patient's heart at rest. And then we give them stressing medication. And then we take another image of the patient's heart after the stress. So the cardiologist can compare the two images of the rest heart and the stressed heart, which can kind of give them an idea if the patient has any blockage in any of their arteries. So a really awesome preliminary test that we can do on our patients here to find out if their symptoms are indicative of a heart attack. And like we said, a heart attack is different from a cardiac arrest. So the stress test is looking for blockage in the artery, which would be a heart attack. And then now we'll go into kind of the cardiac arrest part. So obviously I have a huge passion for the heart and cardiac patients. But like we were talking about in our small group today, when we broke off, I think that the American Heart Association has really gotten this down. I feel like with the easy 2 steps, like we said, calling 911 and then performing the hands-on CPR, which I will demonstrate. It's a really simple step that allows people not to be so fearful in the community when they have someone who collapses or goes into cardiac arrest. Again, with the pandemic, and I was talking about this in the group, I feel that, everyone would be very terrified if during a pandemic they were also being required to do a lot of mouth to mouth. And the American Heart Association really stresses the importance of, the hands on the chest, giving that good compressions, which helps perfuse the blood in the heart to the brain and is life-saving, and that's the only thing that they really stress as the importance when you're performing CPR. So no having to worry about any mouth-to-mouth resuscitation. The most important thing is to make sure that, your hands are on their chest, giving good quality compressions, perfusing that heart to their vital organs. So I have some notes here, kind of want to go through the steps, but also, you know, what is the goal of CPR? What happens during CPR? And what happens if I perform CPR incorrectly? I think these are a lot of questions that we all have, and maybe are, again, fears that we have. So I just want to start with the goal of CPR. Again, the goal of CPR is to keep the blood perfusing the vital organs. So for example, the brain. So let's start off with the steps. So we walk into a room and we find an adult who is laying on the ground. The first step, and these are, again, 1, 2 steps. So the first step is we walk into the room, we see them unconscious, we tap them, shake them vigorously, and ask, are you okay? Are you okay? If they do not respond, either we have to call 911 immediately, or if we have a bystander, we yell to them, making sure that they hear us, call 911. So once we get the call placed to 911, the next step, so step 2 out of this 2-step process, is to get our hands on the chest immediately. And so if we have our hands on the chest, we are compressing 2 inches, which I know does seem very large, a large amount to press into the chest. And again, it is 2 inches that we are compressing our hands. And the hands, the demonstration of the hands is the heel. So our heel of our hand, and then we take our other hand and place it over the top. But the heel is really where the pressure comes from, where we're able to push down on that heart and keep it perfusing. And this other hand is really to help us get more pressure, because we are wanting to compress 2 inches, and we're wanting to compress very hard and very fast. So this is the hand position. So again, depending on what you're more comfortable with, but whatever you're comfortable with, try to stick with, so we're not delaying any care. That heel, that hand is very important. And then also the placement of the hands is in the center of the patient's chest. And, you know, it looks, you're like, oh, the center, I'm not really sure where that is. It is different on everyone, but you kind of find their sternum, you go right below it, and that's where you compress. And I think maybe somebody might ask, why not a little bit lower? Why not a little bit higher? I mean, lower we have our diaphragm, and we're not going to do the patient any good by pushing on their diaphragm. So we're wanting to push on their heart. So compressions hard, 2 inches, right in the center of their chest. And, you know, I know that another concern is that we have our ribs. Our ribs are surrounding our heart. So, you know, I'm not going to lie, like ribs can break, and that's not the goal of doing CPR, but it is a reality. And, you know, a few broken ribs is better than not having the heart perfuse the brain during that time. So just something to expect. So 2 inches in the center of the chest. And another thing, while we're perfusing the heart, you know, we're doing this to perfuse the heart so it gets to the brain and other vital organs. We're pushing down on the heart. And in between compressions, we want to let the heart recoil. And recoil is basically allowing the heart to fill up again. So we're pushing down, allowing the heart to recoil, pushing down, allowing it to recoil. And it sounds like we might have some time in there, like, oh, we got time to let the heart fill up, but it's very fast. I mean, we do want the heart to fill up again with blood and push down again, fill up with blood and push, but it's a very fast time. It's 100 to 120 beats per minute, which is hard to kind of know, but so I've used this in real life. So Staying Alive is the perfect song with a correct beat to push with the beat of Staying Alive. So with that hand position, with that depth, with that spot, and with that rate is really, and those things sound like a lot, but you know, we got the step of, hey, I need help, starting compressions, and hand placement, depth, rate, you know, just kind of going through all those again in your head is life-saving to get. And just remembering that the goal of this is to perfuse. So we, you know, think about the heart just filling up, perfusing, filling up, perfusing. We're doing the work of the heart. So it's very, very important. The next thing I would like to talk about, again, is perfusion, the rate. I guess kind of just remembering that CPR, like some CPR is better than no CPR, really making sure that we're not hesitating. You know, and if, I guess another thing I like to stress, and this happens, you know, and is it's tiring. I mean, it's a very hard thing to do. And I'm sure you would get tired, but if you have a you know, remembering that this is life-saving can hopefully keep that adrenaline going for you. If there is a bystander you want, who all of a sudden walks by, you want to continue to do your compressions. Don't stop. But if you are tired and you see them, I mean, yell out to them, even if they're far away, yell out to them and call them over. And while you continue to do compressions, say, I'm really tired. I think this is my last round. Like, can you take over? Because it will be tiring, but just continue that CPR until emergency personnel arrives with an AED. So it's just really, really important to make sure that you are continuing with those compressions. And I guess I spoke about this earlier, how I feel like the American Heart Association really has gotten it down with making it very easy for a bystander to be able to call 911 and then begin performing these quality compressions on a patient's heart. And also avoiding the mouth to mouth. So no time off the chest. It's all about the chest. And again, during the pandemic, someone might be fearful of contracting the virus, and might not perform this because they feel like they, you know, of the risk of contracting the virus. So the guidelines now for COVID-19 is, first of all, I'm going to say this the last time, get help, call 911, and then you cover your face with a mask or a cloth and cover the victim's face with a cloth or a mask. And then you begin immediately performing the compressions until the AED arrives. So that is, you know, the new guidelines with COVID is just to have them covering over your mouth. And the chances of contracting the virus are very, very slim compared to the life-saving measures that you are giving to that victim until emergency personnel arrives. I think that might be all I have.
Sorry, need to unmute there. Leslie, that was fantastic. You did a fabulous job. Thank you so much. I appreciate your demonstration and telling us about CPR. So appreciate you joining us this morning. Thank you. So great. So I'm happy next to introduce Dr. Thomas Ray. He is professor of medicine at the University of Washington, who's focused on resuscitation science. And he's also the medical program director for Medic One, which is the Seattle and King County's emergency care system for paramedics. And they respond to over 50,000 calls annually. So Dr. Ray, welcome. Glad to have you here with us.
Yeah, my pleasure. Thanks, Chad.
Yeah, absolutely. So I've got a couple of questions, but I'm going to go off the reservation here at first because I started thinking about this evolution from mouth to mouth and CPR and compressions at the same time to now just hands only, which has happened over the last, I don't know when, years. What led to that evolution, and how have the outcomes changed, or have they gotten, you know, from as a result of that change in the procedure?
Yeah, I think that the change was twofold. One is that, as Leslie mentioned, people are more likely to provide the simpler version of CPR, which is chest compressions only. And again, it's easier. And so as a consequence, more people provide bystander CPR. And as Leslie mentioned, some is better than none. In fact, it's substantially better. So I think sometimes the citizens worry about being perfect or, you know, performing it just right. But in fact, just getting hands on the chest in some form or fashion does the patient quite a bit of good. And so part of the decision making here was to try to encourage more people to lay hands on the chest because it's simpler and it's easier. The sort of the more refined science has compared chest compressions alone versus chest compressions with rescue breathing. And we know in that early phase, when the patient first collapses, they still have plenty of oxygen in their system. And so initially, all that is required is the chest compressions because it takes advantage of that oxygen reservoir that's still present. Now, when you get out 10 or 12 or 15 minutes, then it's important to add oxygen back into the mix. But in that scenario, that's where our EMS providers arrive. And they're the ones who add the ventilations or the rescue breathing, in essence, back to the CPR model. And so it really does work well. The lay person, the citizen, does chest compressions only, and then the EMS professional adds back the rescue breathing or ventilation.
Yeah, great. Thank you. Well, we heard earlier about the success rate of CPR outside the hospital, and apparently there are good places and bad places to live if you happen to have a cardiac arrest, and Seattle happens to be one of those. So how good is our survival rate, and what contributes to that?
Yeah, so Seattle and King County, and in fact, the whole Pacific Northwest region really is one of the best in the country. And we participate in a registry called the CARES Registry. And our whole state, the whole state of Washington participates. And we consistently rank near or at the top in terms of survival. And a key part of that is our citizen involvement, right? And so resuscitation from cardiac arrest really is a team sport. And it turns out that some of the most important members of that team are the people that are sort of least experienced and least trained, and that's the citizens. And because they start the whole process, they call 911, they get the ball rolling, and they lay hands on the chest. And we know if they do that early, they set the trajectory for that patient so that when the professionals do arrive, they either have a patient who is primed to sort of recover their pulse and to do well, or they're sort of working from behind the 8 ball. And so you're absolutely right. Some communities, some systems do that better than others. And again, so we have a multifaceted approach. The AHA and other organizations really do a terrific job of reaching out to the public and getting them to take part in CPR education. You know, our schools train CPR. That's part of our program here in King County. And then the other key cog in this bystander CPR is our dispatchers, our 911 call receivers. And so, as Leslie mentioned, when you call and that dispatcher picks up the phone, they will ask for your address so that they can send help right away. And then they will ask a couple of questions. They'll ask of whether the person is conscious or awake. And if the answer is no, they'll ask, well, are they breathing and breathing normally? And if the answer is no, then they appreciate there's a high likelihood that person's in cardiac arrest. And so that dispatcher is your partner, and they will help coach you. They'll help you identify the arrest, and then they'll help coach you in the CPR, getting the hands in the right place, pushing on the chest. They'll give the cadence, right? Push, 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 so that you don't have to worry about that rate. And it's that teamwork. It's the education that happens beforehand in the classes, and then it's the teamwork from the dispatch 911 operators. And collectively, it really enables us to perform CPR prior to EMS arrival in more than 2/3 of patients who suffer cardiac arrest. We're not satisfied with that, right? I mean, the right answer is 100%, but we're substantially better than sort of what you showed as the national average. And we keep pushing on that to see if we can move it even higher.
That's great. So through the past 12, 18 months have you noticed? What have you noticed, through the pandemic has been going on?
Yeah, the pandemic has really been a challenge, not just here locally, but across the nation and around the world. We have reports from all over the world. Resuscitation, as you know, Chad, is such a time-sensitive activity.
Yeah.
And seconds matter. And so the mitigation effects to protect the rescuers have slowed response. They've slowed citizen response, and they've slowed professional response, and they've made it harder in the hospital to do the work. And we know nationally that's taken a toll, that we haven't, the more recent reports from the national platform are that survival has dipped back below 10%, which is, it's a step back. I think it's very likely attributable to all the mitigation realities that have come to bear with COVID. But we'll just double down, work harder, and figure out how to be that much smarter and push survival back in the right direction.
Yeah. So how does the Heart Association kind of contribute and support the work that you do?
Well, again, I think the AHA has a number of critical roles. And the first is to keep sudden cardiac arrest on the radar, right? It's a sudden event. It happens, and you see most of the time people die. And so it's not a condition, but, again, all conditions are important, but, cancer, right? You are diagnosed with cancer and you have weeks, months, and hopefully years. And so it becomes a topic of conversation. Sudden cardiac arrest is something that happens and unfortunately suddenly ends life. And so that the person, the survivor, we don't have the survivors, or not as many as we would like, to tell the story. And so the AHA really takes on that role of telling the public health story, how many people die from sudden cardiac arrest, how we can do better with survival. So I think that's one very important role, is sort of with the public, communicating, advocating. And I think for me personally and professionally, they're an important source of education, advocacy, and also research funding. And so we're part of a consortium at the University of Washington that works with other academic centers around the United States to look at sudden cardiac arrest, understand its causes and its treatments. So UW works with Northwestern, Vanderbilt, and University of Michigan. And then we actually partner with local institutions to do some of this work. So we are working, for example, with Seattle colleges, which is the community college system, to do some simulation work on sort of best practices for resuscitation. So they really have a number of roles, both in research, but also in public communication and advocacy. It's a really important partnership.
Great. Yeah, so I'm my business is research and life science. I'm always interested in that aspect of it. Is there anything kind of new and up and coming emerging findings in research and resuscitation that's on the horizon that people don't know about yet?
Well, I think there are a number of domains, and I appreciate we can only talk for a few minutes, so
yeah.
I could talk about this all day, of course. But I think there are, one of the sort of the ideas here is we have the links in the chain of survival. And those are conceptual. And what we really need to do is move those into implementation or operational phases. So there's a big push with regards to implementation science. How do we take the concepts and move them out into the real world? And so one of those ideas that's sort of near term and is this idea that the dispatcher can identify and coach CPR over the phone. That's an old trick in our world, but you would be surprised across the country and around the world how few. And so the AHA has been critical in advocating at regional, state, and national levels to make that a requirement. So I think that's near term. If we think about sort of longer term and bigger picture, some of the geospatial smart technologies, like your phone, right? It can tell you where the closest Starbucks is. And there are now applications which can alert you to a nearby person in distress. And these are integrated with your 911 dispatch center, and they crowdsource when someone has a potential cardiac arrest and alert the app user that there's a nearby person who may have arrest. And then your decision is whether you have the opportunity to go and help. And so some of these programs are just finding traction, and they've been in some places remarkably successful in delivering the citizen to the patient quicker, sometimes with an AED. So I think that's an exciting program that's on the horizon for our region and for other parts of the world.
Yeah, that's great. Well, I personally appreciate what you do. It's very, very important. My arrest did not happen here in the Seattle area. It happened in another part of the country, but there's somebody there that is doing a job just like yours of train people. And fortunately, I survived it. And I appreciate all that you do and your research and what you're doing to help us have that higher outcome and better outcome here in King County. So thank you so very much for joining us. We really appreciate it today. Just very quickly, before I switch over to our next guest, are there any questions from the audience that you are just feel compelled to ask, would like to know from Dr. Ray? Wait just a second to see if there's something out there. Okay. Well, again, thank you very much. So there's someone else that's joined us today that understands the importance of what you do and the value of CPR. And that's Dwayne Bradford. He is a survivor. And so Dwayne, thank you very much for joining us today. And I'm going to turn it over to you so that you can share your story with us.
Good morning, everybody. A great day to be alive. I just celebrated 9 years of survival since I went down full cardiac arrest. I had just driven across the United States with my daughter in a U-Haul truck, got home. My wife and grandson flew in the next day. They walked in the house at 1 o'clock, 1:15, I was dead on the floor. They called 911. Both my daughter and my wife had been trained on CPR. At that time, the dispatcher said, "Don't start CPR, roll him on his side." Thank God the planets were aligned that day. East Pierce Fire and Rescue had a 4-minute response time to my house. They had just been training on the type of event I had. My neighbor coined it right. He said, "Dwayne, it was funny." He said, "Fire cars kept showing up. These paramedics were jumping out both sides." He said it was like watching a clown car unload. I guess I was show and tell that day. But I woke up 4 days later in the hospital, had no idea what had happened to me. And then I started to learn how fortunate I was. They had already told my family I wouldn't know who they were. I'd probably spend the rest of my life in a nursing home. I'm still tied to the bed when I come to, and I start shaking my hand, and my wife goes, "Do you want a pen?" And I nodded. I started writing her notes. She broke into tears and hit the floor because she had already made peace that I wasn't going to be there. After it was over and I got to talk with the paramedics that took care of me, you always hope that if somebody's going to break your ribs doing CPR, at least it's the biggest, toughest fireman on the crew. And in fact, on mine, it was the little squirt on the crew was the one who did CPR on me all the way to the hospital. They had to stop and pick up extra firefighters partway down the hill because the little guy was getting pretty tired. So they picked up some relief. Listening to Leslie talk about the Pulse Heart Institute is very dear to my heart, along with Multicare. That was where my survival got really, really good. I do not like the nuclear stress test. I don't care, Leslie, that test sucks. But coffee is the antidote for the way you feel, so that helped. But what our family has learned through this whole thing is, if you know CPR, my biggest fear is, are people going to react? In my case, minutes and seconds is what kept me alive. You know, here I am 9 years later. I get 2 birthdays a year. I get my cardiac arrest birthday, and then I get my regular birthday. The kids think it's kind of a ripoff, but they're pretty good at taking care of me each year. But for our family, we invested in a gift that had been given us through the CPR and the medical care that we got. When friends come over or I meet anybody new, this conversation still comes up 9 years later. You walk in my house, the first thing you see is a picture of all the paramedics that were on my call. I may have survived 9 years now, but I live this every day. Our family is very grateful. It's as emotionally to me today like it was the day it happened. The other funny thing is after I got through this, and I had done some things with Multicare and with the Pulse Heart Institute, I had reached out to the American Heart Association several times and said, what can I do to help? And I didn't get a response for over a year until Dr. Krishnan kind of got involved and put my name in the right hat. I'm really grateful to be here with you all. We talk CPR here every day. My grandkids, with the exception of my 2-year-old granddaughter, every one of my grandkids went in for CPR training shortly after I came out of this event. My wife and I have probably been to 7 or 8 of them. If they're giving a first aid class down at the fire station and I see them there, I'll pull in and just ask if I could go in and talk to these people and encourage them as they learn these things. Make sure you're strong enough and prepared to react. In this day and age, COVID or no COVID, I travel a lot for my career, and I've been in the airport and seen people go down, and I've watched hundreds of people walk by that don't want to get involved. And then I'll see a 90-year-old woman sees somebody go down and she's over there the best she can trying to save somebody. That's my fear, is people won't react. But as far as for us, CPR saved my life. It saved my family. I think of the things over the last 9 years I've got to see as a result of this. My family is more than grateful for what all of you do in this profession, and for the kindness and the care that was given to me. The only thing I have to worry about now, 2 stints later, I'm fat and sassy, and every time I go visit with Dr. Krishnan on my yearly visit, I just get chewed out because I'm fat. So if that's all I have to worry about, I've had a pretty good life with this. But Chad, you and I are in a very elite club. When I went down, the survival rate in East Pierce jurisdiction was 0.4%. Shortly after that, it was near 50%. So I tell all my friends, if you're going to have a heart attack, come to my area. You get a better chance for survival up here. So, keep up with what you're doing. I'm so grateful for what all of you do. And I can't say thanks enough. Thanks for the opportunity to come share a little bit of my story with you. Thanks, Chad.
Yeah, Dwayne, thank you very much. I really appreciate that. And yeah, I totally, I feel you in a lot of ways. I didn't break any ribs, but man, I had a really sore chest for a while. Unfortunately, about a month later, I got a bad cold and I was coughing a lot. And that just, man, that, you can imagine that made it a lot worse. Of course, I could laugh about it now. And I agree with you. Every day's a blessing, and a great extra day, because I turn, in fact, by the way, I turned 5 in September. So, yep, I got 1 in September and 1 in October. So I celebrate the same way. So thank you very much for your story. Guys, it goes to how important the mission of the Heart Association is. And there's so many things that they do, so much research they support, so much awareness that they build. But when you think about the immediate impact of CPR training, the hands-on process that we're learning now, we've learned about over the past couple of years. You think about that one kit, that one person that might learn how to do CPR. That could be you in your life or somebody in your loved one's life. It pales in comparison to the commitment that we should be making to them as well. So I really ask that you think long and hard about helping further the mission of the Heart Association. Join me in the Leaders with Heart. Join any of the events. I'm sure Bill would love to have you on the Heart Walk later this year. So we're glad that you're here. I'm so thrilled with the turnout. We've had almost 75 people here. So I thank each of you, and would certainly appreciate you staying in touch. And if you want more information about Leaders with Heart or about CPR training or AED or first aid classes, you have the contact information here. So we'll wrap this up. Special thanks to Leslie, Dwayne, Dr. Ray, and Multicare for all that you've done today. And hope to see you again on another meeting. Everybody have a great rest of the week. Bye.